So, Ms. Jackalone, can you share a little bit about some of the parent rights and concerns that were mentioned today?
Mandy Coker is also up here with me, just in case you all have specific questions that I'm unable to answer. Mandy Coker is our state designated mental health coordinator, and I appreciate your efforts working with the team to put the plan together for you all to review tonight. As you all know, we've stated many times, and we've worked very closely with our school board attorney to ensure that any service that we deliver to a student is under the guise of parental consent.
Good evening, Board. My name is Alexis Spiegelman, Moms for Liberty, Sarasota County. Regarding a discussion that took place in March of 2021,
Debbie Jackalone, Penny Reedinger, and Jane Goodwin
led the Zoom where they discussed guidelines for promoting safe and inclusive schools. Jane was careful to point out distinctions between policy and procedures.
We have district procedures.
Procedures don't have to go before a school board. Policies do. And so I say to school boards, remember that, because sometimes it might be easier to start with doing the work of training and doing some of that work with the schools and with the students and not bring as much to the school district, because we have a wide range of views from our community as to what work we should be doing. So I will leave it at that.
Went on to train all of our school administrators, principals, teachers, and support staff how to use them.
We started out with intensive professional development for our student services team.
This is often referred to as professional development.
But the first thing I want to say broadly is professional development training.
This also helps increase our internal professional learning for our mental health providers.
Cultural competency professional development training. And I do them regularly. In fact, over 30,000 folks in this state, principals, assistant principals, school counselors, social workers, school psychologists, have all had professional development training on LGBTQ.
A couple of the expenditures that I'll just run down in terms of the mental health plan include our contracted mental health services, the addition of 5 social workers, the decrease in the student services ratio to 1 to 400 per counselor, 1 to 1,400 per psychologist, and 1 to 1,177 per social worker.
And the rationale behind that is in Sarasota, our student services team are our school-based counselors, our school psychologists, our school social workers, our mental health therapists. These are often the go-to people for students who are in need of support. In addition, we trained our operational side of the house, our school transportation supervisor, our human resources managers, our transportation food service directors, our custodial staff, people who interact with students, but on a peripheral level. We also knew that those staff members were critical because they see students every day. And if we trained them to have conversations and build relationships with those students, they could also be on the front line of support for students who may need something extra.
I want to add a couple of things. It all starts in the classroom and those relationships between the classroom teacher and the kids.
Deb Gaglione talked about how this training gave them the opportunity to gauge how teachers' mindsets were and then influence those if they weren't in agreement.
That was our opportunity to learn about the mindsets of our administrators in the school district. It also gave us a starting point to help us decide where we needed to focus in more on professional development and creating an awareness about these guidelines and how we could further support schools who weren't quite there with their mindset. For our student services team, we had a licensed clinical social worker provide training for our staff on how to provide counseling and therapeutic interventions, either individually or in small groups, to students who are in need.
Within our multi-tiered system of support, our school-based staff are, within our procedures, providing interventions for that student. So they're trying to work with the student in a level of not therapeutic, but just providing additional support to that student. So they're already aware that, hey, we are providing interventions internally, and there may be a little bit more support that's needed.
This past year, we've done a couple things. We've offered LGBTQI training and professional development on all of our professional development days. We have offered in-service and professional development to our Gay Straight Alliance advisors. And this upcoming year, we're having part 2 for all administrators. For us, I think it's important to note that this work is ongoing. And
social emotional learning, my understanding is that there's not something that the state of Florida is utilizing, and that we're more focused on resiliency toolkit. Resiliency toolkit.
Resiliency toolkit.
Resiliency toolkit.
And all of those elements. And so when we look at the words,
The verbiage is very important for this
guideline?
We had a lot of discussion at the beginning about defining key terms, and a lot of that credit goes to our Equality Florida director, Dee Palazzo. She really did a great job of keeping our district informed with vocabulary.
So once again, we are purposely vague. We as school people are saying, should we do this? Should we not do this? And then that brings about conversations oftentimes between the student and the counselor to talk with the student. Have you come out? Are your parents aware? Do your parents call you by this name or that name? And how can we support you? Because you realize as your teachers and our school staff call you by this other name, your parents are going to find out. They are going to know. At the school level, speak with our teachers that we absolutely will go along with what the student wants to be called.
We all know that calling somebody by their non-preferred name, it could raise a lot of emotionalities and feelings of distress within those students. Teachers say that they are fearful that by calling a student their preferred name without parent permission will put them in a litigious situation. So we've had to navigate them through those conversations.
Deb and Penny, a question from the chat. What if a parent doesn't abide by or wish for those pronouns to be used?
Well, that is when we have the conversation with the parent to talk about our guidelines and the fact that we do honor the student's request, because obviously the student and the parent must not be talking at home